Cloud. Okay. All right. So um, the distribution of blood to the tissues. Okay. Blood distribution varies according to metabolic need of individual tissues. Okay. They're governed by very local mechanisms and homeostatic reflexes. Okay. So um, I'll explain that in a little bit more detail as we go along. Okay. Um, so the flow of the arterioles are arranged in parallel. Okay. That actually makes it really easy to control because if you basically if you arrange them in series, they actually don't work that well. Okay, because anywhere where you shut down one tube, the downstream has to get bigger. But if they work in parallel, it actually works really cool ways. Okay. Um, okay. Okay. First thing, um, the cerebral blood flow is nearly constant. Okay, your brain is encased in the skull, and therefore it cannot accommodate too much blood. Okay, like cerebral hematomas and stuff. If you have too much blood in your brain, it'll kill you very quickly. Okay, your brain is really soft and squishy, surrounded by a very hard chamber. So any amount too much blood going to the brain can cause damage. Okay, cause pressure to develop in your brain, which can kill you. Okay, same thing with too little blood. Okay, so the cerebral blood flow stays nearly constant, but even in the brain, through MRIs, you can see there's blood flow changes when you start thinking, when you start, doing stuff like logic, reasoning, and processing, trying to understand language. You see more blood flow through those regions of the brain. Okay. All right. Okay. So this is why um, being parallel actually works. Okay. So anytime I want to put pressure on B, so B gets smaller, the other three arteries or arterioles, depending on what they are, can compensate. And so if it doesn't go through B, then it goes through the other ones. Okay. So I can control every tube and the other tube will compensate. Okay. So the orthostatic hypertension triggers a baroreceptor reflex. So let's take a look at what that actually means. So I'm gonna skip forward here, talk about the first. So share, oops, share, I'm gonna make sure I share sound.
Have you ever stood up and gotten dizzy or even fainted? This head rush or dizzy spell is known as orthostatic hypotension or positional low blood pressure. It usually happens when you stand up abruptly and your blood pressure falls temporarily. Most of the time we recover within seconds. In this video, we're going to outline the relationship between postural change, blood pressure, and cardiovascular reflexes by inducing orthostatic hypotension. The most important function of your cardiovascular system is to maintain appropriate blood pressure to your brain. If blood pressure goes too high, blood vessels can burst and cause a stroke. If blood pressure falls too low, the lack of oxygen to the brain can cause syncope or fainting. One way to cause a fall in your blood pressure is to stand up from a supine position. In a clinical setting, we can simulate this by using a tilt table such as the one as Kevin's on now. We also have Kevin hooked up to a machine that's monitoring continually his beat-to-beat blood pressure. By tilting the table, we can quickly take Kevin from lying down to standing up. If his autonomic nervous system is working correctly, we should see his blood pressure fall, and then within a few heartbeats come back to normal. Let's see why this happens. Kevin is lying down relaxed. Gravity is even along his body, and his blood is distributed so that none of it is below his heart. Without having to overcome gravity to move blood up from his feet back to his heart, Kevin's heart does not have to generate a lot of force to maintain adequate venous return. Now Kevin has been tilted to a position where the majority of his body is below his heart. Because of gravity, the blood in his venous circulation is forced to stay in his legs. More blood in his veins means less in his arteries and a decrease in arterial blood pressure. The more we tilt Kevin upright, the more gravity plays a role. In a full standing position like we have Kevin in here, 70% of his blood is below his heart. This means that the blood in the venous circulation has to overcome gravity to get back to the heart. Let's see what his blood pressure is doing. Here we see Kevin's blood pressure as it rises and falls normally. The peak represents his systolic pressure, and the valley represents his diastolic pressure. Notice here that when we tilted Kevin 45 degrees, his systolic and diastolic pressures both fell before coming back towards normal. When gravity causes blood to pool in the legs, less blood returns to the heart. This means less blood is pumped in the arterial circulation. This is the direct cause for the decrease in blood pressure you have when you stand up. Less blood being pumped to the brain means less oxygen to the brain and you become dizzy. Why don't we get dizzy every time we stand up? The answer is the baroreceptor reflex. Baroreceptors are pressure sensors located in your carotid arteries and aortic arch. If you stand up and your pressure gets low, your baroreceptors trigger a reflex that returns your blood pressure to normal. Let's see what happens. Here we can see Kevin's blood pressure just before we began to tilt him. We can see here there was a decrease in Kevin's blood pressure when he was tilted upright, but notice how quickly it was restored towards normal. Now let's see how this takes place. Remember that blood pressure is a function of cardiac output and peripheral resistance. Our body helps maintain blood pressure by changing one or both variables. What would you predict must happen to cardiac output to increase arterial pressure? We increase the amount of blood leaving the heart, which is cardiac output. And what two processes determine cardiac output? Cardiac output is determined by heart rate and the force of contraction. We can't show an increase in the force of contraction, but let's take a look at Kevin's heart rate before and after we tilted him. See how his heart rate increased in response to the decrease in pressure? Cardiac output is only half the equation. What change in peripheral resistance would help raise blood pressure? Peripheral resistance should increase. This happens when sympathetic input causes arterioles to constrict. When baroreceptors sense a decrease in blood pressure, they restore blood pressure by increasing heart rate, increasing the force of the heart contraction, and by constricting arterioles. When you're dehydrated, in poor health, or in a hot environment, you're more likely to experience symptoms of orthostatic hypotension because your body is unable to respond appropriately. Most of the time, however, the baroreflex happens so quickly we're unaware of it. Next time you stand up and feel dizzy, you'll have a better understanding of the physiology underlying orthostatic hypotension.
All right. So orthostatic hypertension on the test, okay? So make sure you understand that. All right. Okay. Okay, so there you go. Here, the baroreceptors that we were talking about is all right here. Okay, so the carotid and the aortic arch, okay, have baroreceptors, so they measure pressure. Okay, and your sympathetic nervous system kicks in a little bit every time you stand up, and so it adjusts the pressure. Okay. All right. Okay. Okay, so there you go. And it does that by adjusting your heart rate, which adjusts your cardiac output, it adjusts your force contraction, which adjusts your cardiac output, and it adjusts your TPR, which adjusts your TPR, total peripheral resistance, okay, which changes the blood pressure. Okay, this is a increase. This is a response to increase. So the orthostatic hypertension will be a decrease in blood. Okay. Okay. So hopefully that makes sense. Okay. 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 So there you go. The other thing that you have baroreceptors, um, pressure receptors, right? You also have chemoreceptors. Chemoreceptors can be activated by low O2, which then can cause your heart to beat faster by increased cardiac output. Okay. Okay. So blood pressure is modulated by hypothalamus and cerebral cortex. So you can again fear. There's a fear response, right? Learn emotional responses. Um, you're nervous before a test, etc., etc. You also lead to vasovascular syncope, which is another word for saying like passing out from the fear of blood and stuff like that. That's the most common one, right? People see blood and they faint. Um, that's simply because there are some things that trigger a sudden slowing down in the heart, and the sudden slowing down the heart, okay, combined like with other factors can cause you to faint. Okay. Like dehydration. So if you have low blood pressure to begin with, then dropping just a little bit can cause you to faint, right? If your blood pressure is elevated, then not so much. Okay. Okay. So plasma exchange in the capillary. So the whole purpose of the blood vessels is basically tubing, except the capillaries. Okay. So in anatomy, we learn the three types of capillaries. So maybe go over those. Okay. So fenestrated, continuous, fenestrated, and sinusoidal. Okay. Um, okay. Okay. So one, velocity of flow is important for material exchange efficiency. The slower the flow, the more efficient the exchange. Okay. Okay. So the slowest flow is in the capillaries and venules where the exchange happens. Okay. So it has the greatest cross-sectional area. So there's more area, surface area in the capillaries than there are in the arteries. Okay. Because there's so many more of them. So look, um, here is the velocity of blood. So as the surface area increases, the flow decreases. Okay. And that means the cross-sectional area increases. And so capillaries are where gas exchange happens. Okay. Okay. So imagine the arteries being your head, and then the capillaries being the spaghetti, right? So you can see that they'll go slower across through the spaghetti and just through your head, but much more volume, much more faster, um, much more gas exchange. Okay. Okay. So this stuff you can read. Okay. Okay. So there is two things that are going on in capillary simultaneously. Okay. There is hydrostatic pressure. Okay. And um, osmotic pressure. Okay. Okay. So hydrostatic pressure is the pressure of standing water. Okay. You learned that earlier. Okay. Okay. So in capillaries, okay, at the beginning of the capillary, okay, there is pressure pushing, hydrostatic pressure is pushing water out of the capillary. Okay. So pressure is higher up here than over here. So the pressure is leaking out of the capillary into the interstitial fluid. Sorry, extrastitional fluid. Okay. So this is leaking out. Okay. Osmotic pressure, okay, is pushing fluid in. Okay, so there are big proteins and stuff that are in the capillaries that are not into the extracellular fluid. So the pressure is leaking in, but just a little bit. So 32 is greater than 25. So what you get overall is a leaking of fluid out. Okay, so at the beginning of the capillary bed, fluid leaks out. Okay, by the end of the capillary bed, fluid is leaking in to the capillaries. Okay, because the osmotic pressure stays roughly the same. Okay, but the hydrostatic pressure changes because as it goes through, things are leaking out already. So by the end, so much have leaked out that things are now leaking back in. Okay, and now the osmotic pressure is greater than the hydrostatic pressure. Okay, so let me try to explain this one more time. At the very beginning, the hydrostatic pressure is pushing the fluid out, and that does it all the way through. But at the beginning, it is higher than the osmotic pressure. Okay, and therefore the total direction of fluid flow is out of the capillary bed. Okay, by the very end, the total amount of fluid flow is into the capillary bed. Okay, because the red arrow stays the same. Okay, the blue arrow goes from bigger than the red arrow to smaller than the red arrow, and therefore the fluid flow is the opposite direction. This amount of gas fluid exchange is what makes your capillaries work. Okay. I know in anatomy and in biology classes, or in high school, we teach you guys like capillaries and veins and arteries are all like closed tubes, and blood is flowing through your body. That's not actually true. There's a lot of leakage that comes out. Okay, the net flow out is 3 liters a day. Okay, if you think about it this way, your total blood volume is about 6. So half of your blood actually leaks out per day. And if you take away the white red blood cells, then pretty much your whole plasma leaks out per day. Okay. Obviously, this is going to be a problem. And so if fluid leaks out, it better have a way of going back in. And that is why we have a lymphatic system. Okay. So the lymphatic system collects these green things, collects the leftover fluid, and it drains it back into the blood supply. Okay. In other chapters, we'll explain why it's a great place for pathogens to hide out, and a great place for white blood cells to hunt down pathogens and kill them. Okay, but for right now, the lymphatic system is just a way for the blood to drain the interstitial fluid back into the bloodstream. Okay, they enter in a couple of different places into the major veins, and they respond to the fluid flow. So they empty back into the blood supply. And that's how you stay normal. All right, so let me take a look at this. Okay, so this colloid pressure of proteins is pushing the fluid back in. Okay, these are proteins that are in your blood. Proteins in your blood require you to eat proteins. Okay, if you do not have enough protein in your blood, then you can't. If you don't eat enough protein, then you don't have enough of these proteins in your blood. If you don't have enough of these proteins in your blood, you can't generate the orthostatic pressure needed to push the fluid back into the capillaries, and therefore they stay in the interstitial fluid. And this is what you end up. This is called washcore, protein malnutrition. Okay, like when we saw these, you guys have seen this picture before, and if you were anything like me, you wonder why the hell does this kid look like he's starving but has a really full belly? The reason why he has a really full belly, okay, is because of the interstitial fluid not being able to go back into his veins. Okay, and that can actually cause potential damage to his heart and stuff. Okay, because blood supply is dehydrated because all the fluid is not reaching back in the way it's supposed to. Okay. Okay, so risk factors for cardiovascular disease. Okay, smoking, obesity, not controllable, sex, age, family history. Okay, controllable things, obesity, untreated hypertension, etc. Diabetes. Okay, atherosclerosis. I'm sure all of these you guys already know. Okay, these are plaques. Plaques can make the blood vessel smaller. Making the blood vessel smaller puts it under very high pressure, and therefore it can cause damage. Okay, so I'm sure you guys already know this. Okay, and shoot off like chunks of fat and cause heart attacks and strokes. Okay. Okay, so okay, hopefully that makes sense to you guys. Okay, all right.